About one-third of the world's population is infected with TB, and nearly 2 million people die from the disease each year. TB is particularly devastating in third world countries.
In most third world countries, particularly in South America, Africa, Asia, TB is very common. TB is one of the most common causes of disease and illness and death in third world countries. So it's not uncommon for people to become infected if they're living in one of those countries.
The World Health Organization had a plan, a 10-year plan to eliminate tuberculosis. But the problem is that in every place but the United States and third world countries, sub-Saharan Africa, China, Southeast Asia, it's at epidemic proportions. So it's still killing between 2 and 3 million people a year.
The United States and other industrialized nations faced their own TB epidemic 100 years ago. Back then, public health officials fought the disease by building TB hospitals that segregated and treated those who suffered from the disease. After the introduction of antibiotics in the 1940s, the incidence of TB steadily dropped in industrialized countries for nearly 4 decades. However, in the 1980s, this trend stagnated, and in some cases, TB cases actually began once again to grow in some developed countries. This increase can be attributed primarily to 3 factors: the high rate of immigration from countries with a large number of people infected with TB, the rising level of TB in people with HIV infections, and the emergence of a strain of TB that is resistant to treatment with drugs.
Worldwide, the people who are most affected by TB are people who are HIV infected. Tuberculosis is the leading cause of death among people who have HIV infection.
When HIV drugs began to be available, then people that otherwise wouldn't have gone to the hospital to get the HIV meds were going to the hospital and picking up their HIV meds, but also inhaling TB germs and getting sick and dying. So it's going to be really important anywhere on Earth when you've got people with HIV to think about their risk factor of being exposed to someone with TB. And that includes here in Cincinnati. Actually, we've had an outbreak involving the drop-in center where we had some patients with advanced HIV disease who were exposed to someone with TB, not realizing it, and they became sick with tuberculosis within 2-3 months after being exposed. HIV and TB are bad for each other, and if they hang out together, you can see people get very sick. And if it's a drug-resistant TB for which you don't have effective therapy, you can see people die very quickly too.
Multi-drug resistant TB is caused by bacteria that does not respond to the standard 6-month treatment with the most effective anti-TB drugs, isoniazid and rifampicin.
The germs are resistant to the antibiotics, and the antibiotics don't help cure TB. You're in a much worse position in terms of being able to predict a cure of tuberculosis if the standard drugs show resistance, if the organism shows resistance to the standard drugs.
And the reason that it develops is because if someone is treated for TB and they don't complete the treatment or they don't take the doses on a regular basis, that contributes to the occurrence of that bacteria developing drug resistance. It's a huge problem. It can be very difficult to treat, and in certain parts of Africa, they don't know how to treat certain people who have drug-resistant TB.